Welcome. I'm Dr. Shields Fry, the Program Director for the Brookwood Baptist Health General Surgery Residency Program. Thank you for your interest in our program. We have put together a short video tour of our facilities to help you gain some insight into our program. While we are proud of both our facilities, Princeton and Grandview, the secret to our success has been our people. Again, I look forward to speaking with you in the future about our program, and I hope you enjoy the video. Thank you.
So this is the resident lounge. This is where a lot of us meet in the mornings to hang out. We've got nice couches, a TV, we've got lots of computers for us to work on. We've got tables and a kitchen, candy closet for our snacks, lots of places for us to sit and hang out. We have a medicine and a surgery chief office, and Kathy has an office here as well.
So right next door to the lounge you have the library, which is a real useful area. It's kind of an extra workspace. You've got several computers, you've got different stations you can kind of set up shop. For me, especially when you're on like a subspecialty elective, you can come by and just nice quiet place to relax and do your work. Librarians are here pretty much all the time when you need them. They can pull up reference articles, they can pull up reference books for you, anything you need before rounds or before presentations.
So this is the gym. We have access to it 24/7. It's really convenient. I come here a lot when I'm working night shift, kind of blow off some steam. A lot of times as a resident, you don't have a lot of time to do things like work out, so it's really nice to have this space to be able to exercise.
So here we have the doctor's lounge. It's a really nice area, nice feature of the hospital. Plenty of food options here. You've got an area of food that's great for the go, so when you're on call on nights or whatever, you always have food available to you. You got a specialty chef that comes by every now and then. You got a cooler full of ice cream. You got a common area with lots of table space, so if your attending likes to do table rounds, for instance, you can have lunch and round with your attending in here as well. So now we're in the call room area. There are 7 different call rooms that covers all the specialties, so internal medicine, general surgery, radiology, pathology. No matter what specialty you're on, you have a call room available to you at night. There's a computer and a phone in each call room, so you pretty much have everything you need to get all the work done. And you have a shower available to you as well, and a kitchen area.
There's also extra workspaces if you want to come up here and get some work done. It's a little bit more quiet. There's an area to relax with couches and TVs, and there's a lactation room with a fridge for new moms. We also keep our butterfly ultrasound machine up here. If you get a central line in the middle of the night, it's really convenient just to grab that on your way out.
This is a 402-bed hospital. Each room has its own private bed, as well as its own private bathroom with a shower and sink. Each room also has a couch for family members that turns into a bed at night so they can stay overnight if able. This hospital has a lot of new and updated digital technology, including a digital whiteboard in each room that has patient information, care team information, and any important tests and diagnostics being run on the patient that day, so we can be up to date on what's happening with them, as well as they can be in the know about their day.
Yeah, and on each floor you have a central nursing station. You've got social workers, case management on every floor, so you never have to run around the hospital hunting these folks down. They're always available to you and always willing to help you. On both sides of each floor you have a dictation room for providers with 4 different computers. There's ample space. You never have to run around trying to find a space to work. There's pretty much a computer nearby everywhere you go, so you can set up shop and get your work done.
This hospital has 4 ICU units, a medical ICU, surgical ICU, cardiac ICU, and neuro ICU, all with 15 to 22 beds per unit. The ICUs have an open concept with centralized nursing stations for easy access to the great nursing staff who are awesome working with patients as well as residents.
Each ICU bed is private with a beautiful view. There's plenty of space and a central supply closet on every floor, as well as in each ICU, which is really convenient when you're doing bedside procedures.
The operating suite at Grandview is a new facility. It's very well equipped, very spacious. We have over 30 operating rooms, including 3 robot consoles. One of those is a dual console, and we also have a robot simulator here. All the staff at Grandview are amazing to work with, especially in the operating room. All the circulating nurses, the CRNAs, the scrub techs, they're all very used to working with residents. and we all feel that they've been very important in our training. We have a very high volume of cases here overall in general surgery, as well as several subspecialties. We have orthopedic surgery, urology, ENT, gynecology, gynecologic oncology, and cardiothoracic, just to name a few. We also have a very nice surgeon's lounge, as well as locker rooms right outside the operating room. In the lounge, we do share that with the attending physicians, which allows us a good chance to communicate with them. We also have plenty of computers there to do our work, as well as some snacks and drinks and that sort of thing, just to make the day go a little easier.
One of the unique things about our program is that we get the experience of working at 2 different hospitals. You've already seen our medical education room at Grandview, and now here's our medical education here over at Princeton. It's really our resident headquarters. Our call rooms are housed here, so if you're on call on the weekends or you're on night float, this is where you'll have a bed to sleep. There's also computers in each of these rooms. Also, if you need to take a shower, the showers are in here as well. There's chief offices over here, so that's usually where the chief will be. Also, there's 2 different small conference rooms that you can use for rounding, table rounds, or just studying with co-residents.
Here we have our common area, which is where all the residents can get together and eat breakfast, eat lunch, or just hang out. We have a large pantry full of snacks, and right across the hall we have our main conference room and our library. And as a special feature to this particular hospital, we have our pet fish, Esmolol, which is cared for exclusively by the staff medicine team.
So now we're in the brand new Doctor's Lounge here over at Princeton. We eat breakfast and lunch in here, as well as there's free coffee. There's also 24-hour sandwiches and salads, any snacks that you would want as well. We have about 10 or so workstations that you can chart on. There's also multiple tables. We'll do a lot of table rounds in here as well. It's in a convenient location. It's on the first floor. It's convenient to all of the floor beds, the ICUs, as well as the ORs. There's also couches and chairs, so if you just want to lounge around if you get a free moment. Another nice feature over here at Princeton is our 3rd floor outdoor patio. There's multiple tables with umbrellas. A lot of times different teams will have team rounds out here. There's also cornhole, so if you're up for a little competition, you can play some cornhole, or if you just want to get a breath of fresh air.
At Princeton, we have 16 newly renovated OR suites. We operate in just about all of them. We have 8 endoscopy suites where we do colonoscopies, EGDs, and other GI procedures. One of our OR suites is a advanced endovascular or a hybrid OR where we do endovascular vascular cases and also hybrid vascular cases. We also use it for some advanced GI procedures. We do a lot of ERCP in our program, which I think is a strength and something not many other programs get to do. 3 of our ORs have robotic systems in place. All of them are Da Vinci Xi robots at this time. One of them has a dual console and also a simulator system. Pretty much all of our attendings utilize the robot, and we honestly do more robotic surgery than laparoscopic surgery here at Princeton, so all residents from intern all the way through chief level are exposed to robotic cases in varying degrees of detail. Here at Princeton, we're a breast cancer center of excellence, and we have a dedicated breast center where you'll get a lot of experience with mammogram-guided and ultrasound-guided biopsies. And you'll take care of patients through their initial presentation to clinic, biopsy, surgery, and post-operative care. We also have a weekly breast conference where we discuss patient-specific cases and learn a lot about breast cancer oncology. Princeton is also a bariatric center of excellence, and so you'll see patients again preoperatively through surgery and a postoperative course for basically all bariatric operations. You'll get a lot of exposure to bariatric surgery. At Princeton, we have 4 ICUs. They're a CICU, a surgical ICU, a medical ICU, and a neuro ICU. Each of them have approximately 12 beds. Point to highlight here at Princeton is that we have an intensivist or critical care team that manages ICU care for most patients, and we rotate on that service as residents, and so you get a lot of exposure to critical care, both in a formal rotation setting, but also a day-to-day, just sharing patients with them. They're a great resource to learn from.
Hello, my name is Stan Bro, and I'm the Executive Director for Medical Education here at Brookwood Baptist Health. We appreciate your interest in our program and hope that you found this video to be helpful. Please remember to apply to our programs using the ERAS system on the AAMC website. I look forward to meeting you on interview day or when you come here later for training. Also, remember to check with your program coordinator and check our website and social media feeds if you need additional information. I wish you the best of luck in the upcoming match.